Hi, everyone. This is Denise Nichols from Motivate Therapy. I am an occupational therapist and board certified pelvic floor therapist. And I own Motivate Therapy, which we have 5 pelvic floor therapists. So we specialize in pelvic health. But overall, we like to say that we provide self-care solutions for core health. And today we're going to talk about self-care solutions for overactive bladder. And I am super excited to introduce a resource that everybody needs to know about in the Rockford area, Dr. Sridhar Sridhar. Hi, welcome so much. Thank you so much for joining us today.
Thank you for having me.
So Dr. Sridhar has been practicing both integrative medicine and family practice medicine for over 10 years. So she's board certified in both family medicine and integrative medicine. And so we'll learn more about what that means. But she has a special interest in women's health, cancer, nutrition, and gastrointestinal health. And I love her quote here, which is, "I bring a holistic approach to my patient's care by assessing influences of the mind, body, and the spirit." And in her practice, she always focuses on promoting wellness, preventing disease, and optimizing self-healing. So we have a great relationship because we definitely have like-minded approaches, and we always really reach at anything that has to do with helping our patients be empowered and to take their self-care and healthcare into their own lives and really be the leader in their self-care. Right?
That's right. Absolutely. The integrative medicine approach lets me look at the mind, the body, as well as the habits that somebody has in terms of how they might be affecting and causing a chronic illness or even acute illness that they might be dealing with. And we really aim to try to find the root cause to help with patients instead of just a top-down approach of just targeting symptoms and giving patients a medication. We really want to see if there's something underlying, even if it might not be something severe or serious or dire, something that just may need to be addressed so that we can make the patient feel a lot better and treat the condition for good instead of just putting a Band-Aid on it.
Okay, wonderful. So can you just give us a little bit more information about how you assess, I think most people understand body, but mind and spirit?
Absolutely. So for mind and spirit, I always have, first of all, my patients, both family medicine and integrative medicine, when I'm meeting them for the first time, have them fill out a complete integrative medicine history form for me. And one of the main questions is, what is your spirituality like? Do you believe in a particular spiritual guide? Does that influence you in any way? And just to see if they have some sort of grounding practices or mind-body approaches that they feel are very important to them, because I want to try to help whatever recommendations I give, I want to try to make sure that it takes those cultural and personal beliefs into consideration as well. And then as far as mind goes, we always say in family medicine that 75% of patients are actually coming in with an underlying mental health symptom, not necessarily a disorder, but maybe some sort of symptom. And the more you ask those deeper questions, then you find out really, okay, somebody's pelvic pain might be because they're dealing with some stress in the family, or they're dealing with relationship issues, or they have overflow or bladder incontinence because they're so busy that they're actually not committing any time to go to the bathroom or even like feel and notice their body signals. So that's kind of how a huge part of mind-body influences. We always say in family medicine that 75% of patients are actually coming in with an underlying mental health symptom, not necessarily a disorder, but maybe some sort of symptom. And the more you ask those deeper questions, then you find out really, okay, somebody's pelvic pain might be because they're dealing with some stress in the family, or they're dealing with relationship issues, or they have overflow or bladder incontinence because they're so busy that they're actually not committing any time to go to the bathroom or even like feel and notice their body signals. So that's kind of how a huge part of mind body influences
Yeah.
influences disease or conditions.
Yeah, that's so wonderful that you're being screened at your level,
Right.
at the beginning. That's so important. Give me like a couple of the few top bladder health issues that you're seeing a lot with your
Sure.
patients, male and female, or you could separate them.
Absolutely. Definitely both kinds of urinary incontinence. So birth urge incontinence, which is related to urgency type issues. So they can't make it to the bathroom in time, or they lose a little bit of urine before they make it to the bathroom. Then we also deal with stress urinary incontinence, this is generally in females, again, for both of these, generally, where they cough or they sneeze or they're doing jumping jacks and losing some urine. So those are kind of the main urinary issues we deal with. Of course, we deal with urinary tract infections, and we try to figure out, especially if someone's got recurrent urinary tract infections 3-4 times a year, we're trying to figure out what's going on. Is there a hormonal issue, a hygiene issue, a food issue? Are they eating too much sugar? Something like that.
And so let's talk about what overactive bladder is. And I think people don't understand that it's a group of urinary symptoms. It's not a disease. So it can look differently in different people. Most common symptoms are that sudden onset of urge, and then it turns into urge incontinence. So you might have to rush to the bathroom. You have that urgency, but you have urge incontinence if you can't make it to the bathroom. So I say like, oh my gosh, get out of my way. I'm going to like push anybody out of my way. That's not normal. And I don't think people understand that. We don't really understand what's normal regarding our bladder. Bowel, bladder, and sexual function is really what we address in pelvic health. So, and I think a lot of people don't understand that they have a lot more control. Just because it's an organ, we think we don't have control, I think. So the sudden uncontrolled need to urge to urinate, and that can happen during the day. And then at night, it's called nocturia. So we say normal getting up to pee is 0 to 1 times at night. So you shouldn't get up, or maybe once, but you should be able to go right back to sleep within 10 minutes. If you're not, then now you can have a sleep disturbance, and that can affect your overall health. But your bladder is nervous system driven, so it can affect that as well. So there's that. There's feeling like you're living in the bathroom, going to the bathroom all the time, and then not making it to the bathroom. Those are the common symptoms of overactive bladder. In general, every 2 to 4 hours, your bladder can hold about 16 ounces of water. So it's about 2 cups. And so when you empty, however, a lot of people don't realize that your bladder's not completely empty. It's never empty unless you put a catheter in there and drain it out. You usually have about a half a cup of urine still in there. So if you're so a lot of people feel like they have to rush back to the bathroom in less than 2 hours. So typically it really feels like it's affecting your quality of life if you are going every 30 minutes to an hour. I mean, that's a lot of times, right? That's 12 plus times a day. And that can affect your quality of life because you don't feel like you have time to get anything done. You are always having to rush to the bathroom. You have fear. Fear is kind of dominating your life because if you feel like you have to pee, then now you're fearing that you might leak. You might worry about going to places that you don't know where the bathroom is. And then obviously not sleeping through the night, that can certainly affect your overall health as well. So I think do you have anything to add regarding overactive bladder, like how you would define it?
No, that sounds, that's absolutely right.
Okay, so let's talk about causes. What do you see typically as the cause of overactive bladder?
Weak pelvic floor muscles.
Okay.
So it could be due to pregnancy. It could be due to age and lack of estrogen. It could be due to weight. It could be due to constipation and constantly trying to force those pelvic floor muscles to work to push bowel movement out. It could be due to medicines. Certain medicines can do that. I think that's most of what I can think of as far as the causes go.
Right, right. Yeah, hormonal changes, pelvic floor muscle weakness, or spasms. So it can be one
Or
of the other.
spasms,
We
true.
often assume that our muscles are just weak, and often
Right.
the pelvic floor muscles are overactive.
Good point.
And so that can create problems as well. So neurologic, right, disorders can affect.
Yes,
too.
absolutely. Right.
Because typically we're dealing with two things. So either the signal between the brain and the bladder, we're having issues, or the muscle of the pelvis or of the bladder
exactly.
is contracting, telling the body it needs to go, and it isn't necessarily full.
Right.
Right. So those are the two. So diseases that affect the brain and spinal cord, like MS and spinal cord injuries, things like that.
Yeah. ALS, all those kinds of things. Yeah.
Right. Okay. So, and then you said, so side effects for medication. So let's talk about medication first. So I'm an occupational therapist. And so one of the reasons I got into OT versus PT is because of that integrative approach.
Okay.
OT is, that's how I understood it. And that's why I went to school for it. That you're looking at the mind and the body, that it has to do more about the purpose of movement, not necessarily just the science behind the movement. So understanding that that it is integration, right? That we're trying to integrate the mind and the body. That I was surprised to hear you say that in family practices, do all family practice physicians agree with the 75%? I mean, is that what you're taught in school? Is that 75% of underlying issues that people do family medicine for is mental health?
Yes.
Yeah. Okay.
Yeah.
All right. That's wonderful. So then your family doctor should be talking to you about your mental health and some self-care solutions for mental health. I know, especially now, I think we're all really needing, and I think I'm hoping that the fact that more people are dealing with it, it's going to help it be less of a stigma to talk about. So.
Right. Yeah, no, a huge part of family medicine is the biopsychosocial approach. So we definitely try to, incorporate that when talking to patients.
You want to explain that a little bit, what that means?
Yeah. So the bio part is the, biological, what is going on in your body. The psycho is the psychological part, mental health. And then social is all the social influences, whether it's family, friends, work, economic status, race, all of those kinds of things, poverty levels, all of that.
Wonderful. So it's what I talk about in my book, Your Self-Care Matrix. I talk about creating a circle of trust so that's why I'm hoping people listening to you, they can get a better understanding that, doctors are people too. And even though we have crazy busy schedules, that you have every right and you deserve to feel heard. And I think we need to feel that we trust our provider and that we can be open and honest with them, because how open and honest I am with you is the only way that you're going to be able to truly help me. So
exactly. Yeah. And that's
scared.
Yeah, I was going to say, and that's actually one of the biggest problems with patients not revealing that they even have bladder issues. So that's kind of what I've always been taught, is to always make sure you ask a female if she's having either sexual health issues or bladder issues and pelvic issues, because a lot of people are like, well, that's just normal. I just pee a little bit when I do this or that. And it's like, well, it's not completely normal. We can try to help that. So,
right. Well, and men too, I think, so.
Yeah. And men too. Yes.
Yeah. I this for men, because men, I don't talk at all, but women, it takes an average of 6 years for them to talk to their doctor, any doctor, even an OB-GYN, a doctor that focuses. It takes them 6 years to talk about what's going on down there. So when I teach the College of Medicine students, I get in front of the third year OB-GYN students. I always say, if you don't ask, they don't tell. So, trying to
Exactly.
get the conversation started, because it is an uncomfortable conversation to have.
Absolutely.
Yeah, the statistics for OAB, or overactive bladder, is 30% of women and 40%, no, 30% of men and 40% of women live with OAB. And that's just crazy. So that's basically
Absolutely.
your bladder leading your life.
Right.
So
Right.
we
Yeah. And speaking of men in particular, I'm definitely trying to get better about asking men about it, because I've definitely had men that come and they haven't said anything. And then 2 years later, they have a severe urinary tract infection, and urine, kind of backed up into their kidneys, and their kidneys are swollen, and they need to get like a prostate reduction surgery right away. And it's happened multiple times that it's like, we definitely need to bring that more to the forefront and make it okay to talk about.
Right. And I do hear, when we give our spiel, when we first meet people, they will say, well, how come no one ever told me any of this stuff? And I think often it's, if you're not telling, you're not asking, then we don't know to tell you. So
very true.
All right. So let's just talk about a couple of the main medications. So when we talk about integrative, so Western medicine, we often think of more medications. So you go to the doctor, you get medication. Eastern medicine, maybe we think more of in the mind, body, spirit connection. And so integrative, and that was my point of the integrative, was how can we help you pick the best of both worlds? It's not necessarily an alternative, but it is a complement. We want to complement your healthcare with whatever works best for you based on your awareness. So that's what we really focus on at Motivate. That self-care is, not necessarily bubble baths and eating dark chocolate, but it's choosing what to do for yourself based on the awareness of how you feel now. So consistent, healthy awareness of the now, so that you can grow forward and be an empowered consumer of healthcare. So help us understand the Western medicine, the medications that are typically given for overactive.
Sure. Yeah. So I'll probably use brand names because I forget the other names here, but usually, Vesicare and Ditropan and Myrbetriq, they all work to kind of help with the kind of musculature of the bladder, so that you're not having as much of a stimulation to try to go to the bathroom without you being ready for it. Kind of helps with that overactive neurological signal that you're getting from the bladder. However, they always have a lot of side effects, a lot of dry mouth issues. They can cause constipation. Some of them can even cause like a mental status change. So they're even contraindicated when you're over 65 years of age, certain classes of medicine. So we have to be very careful. And then they can cause interactions. They can raise blood pressure. That's one of the most common side effects. And they can, make it such that other medications work a little bit differently. So we do have to be careful about that.
Okay. Awesome. So the dryness, I think a lot of people, we talk a lot about water, right? So one of the behaviors, we look at your behaviors, and water, often for people who feel like they're living in the bathroom or they fear leakage, the first thing they do is they stop fluid intake. And often it's water, right? They'll drink their coffee. But it's water. Typically we stop drinking the water. And so like you said, medications that dry you out then affect the urine and the concentration of the urine in the bladder. And that can affect and annoy the lining of the bladder, which thins as we age anyway. But often then it can constipate you. So when we look at how the bladder and the intestines basically sit on top, constipation. So it's like having a brick. So the more the intestines just fill and fill and fill, it's like putting more and more pressure on that bladder. And that can affect the bladder in several ways. It can make the pelvic floor have to overwork all the time because there's constant pressure down. It could change the signal of the brain of when that bladder is filling because there's just less space. So drinking of water is important. And I think, unfortunately, when you get the side effects of the dryness, people still will have fear of drinking because they associate drinking water with leaking urine. But like I said, you always have urine in there. So
exactly.